The impact of the built environment on human health has been the focus of recent investigation and development, which has led to the new specialty of evidence-based therapeutic architecture. The traditional system of vastu architecture, a design paradigm for buildings and cities which is proposed to promote the mental and physical health of their occupants, has been applied and studied in the West over the last 30 years and features elements absent from the other approaches. We will evaluate how the built environment influences human subjects according to the traditional architectural system of vastu. We will compare this paradigm to the findings in published research, and then we will make research-based therapeutic recommendations for the general public and for physicians to incorporate into their practices. The influence of the built environment upon humanity has been the subject of intense research within the past 15 years, but as of this year, leaders of the research in this field have admitted to me that the field is still in its infancy and that there's a severely limited amount that is truly known about how the design of buildings can be used to promote human health, and that researchers are mainly still doing basic research. In order to focus some of the research, it would be useful to borrow from the approach that has proven so successful in the field of pharmacology. The world's major pharma corporations are known to employ ethnobotanists who do research in the third world, for instance in the Amazon, to learn from indigenous medical practitioners what botanical compounds they consider to be useful in treating various medical conditions. And the ethnobotanists bring samples of promising compounds back to the laboratory for analysis, and through this process, any number of highly useful drugs have entered 21st century Western medical practice. A similar approach might bootstrap the investigation into the potential medical value of the built environment. Well, the author has researched what is putatively the world's most ancient, still practiced healthful architecture system, which is called vastu. It is the application of the historical texts of Sthapatya Ved associated with the ancient Vedic civilization centered in India. It is practiced in multiple lineages across India today, but not surprisingly, after many hundreds and perhaps thousands of years of practice, though many lineages seem to stem from a common source, its exact application has diverged within the different lineages such that their practices do not precisely agree with each other, and in many cases do not really map accurately over the primary historic texts, making it challenging to conduct research on an authentic and standardized practice in the 21st century. Fortunately, the speaker has identified that the celebrated Indian sage Maharishi Mahesh Yogi, well known worldwide for having introduced the Transcendental Meditation, or TM technique, to the world in the late 20th century, devoted 20 years near the end of his life to reconstituting the practice of vastu in its full effectiveness, in a process that included extensive meetings with the living masters of the system and going over with them the 150 surviving ancient source texts on the subject, until he concluded he had done the best possible job of codifying and standardizing it in order to enable practicing the system of vastu in its most authentic and therefore effective form. So this presentation will be about his system of vastu because of its codification and the resulting standardization, and also because it has been applied to many thousands of buildings spread across every part of the globe in all of those nations shown in tan on this map. These features lend it to being subjected to research protocols. This standardized practice of vastu is therefore signified by attaching Maharishi's title to it, and so it is known as Maharishi Vastu architecture. And its proposed effects are influences promoting physical and mental health, happiness, and growth to self-actualization, and family harmony. And these are tantalizing enough that the subject is well worthy of study. It's all the more worthy of study if this technology is placed in a larger context, in that it's a Vedic technology of consciousness as delineated by Tony Nader, MD, PhD, and as such, It is allied to the TM technique, which was found to reduce death from heart attack and stroke in a population by 48%, and to have decreased hospitalization in all age categories by from 50 to 69%. I was the lead author in a literature review which identified 16 studies conducted worldwide over the past 40 years on either isolated elements of the practice of vastu or on Maharishi vastu architecture in its wholeness. This review was published in April of 2022 in the journal Global Advances in Health and Medicine. The findings to date are highly confirming of the purported benefits, including associations with better mental health, greater physical health, better sleep, and reduced levels of stress. These findings make it worthwhile to present the data, and the data points to the entire medical community. The following points are covered in more detail in the literature review. In a study of 158 subjects who live in Maharishi Vastu homes in 14 countries, since moving into the home, 80% reported that they had experienced improved mental health, 70% reported improved physical health, 85% reported reduced stress, and 88% of parents reported that their children had become happier. Studies that compared a company before and after moving into an MVA office building found significantly higher scores in verbal originality, figural originality, resistance to closure and elaboration, and an 8% higher level of employee health and well-being when working in the MVA building compared to when working just 3 months previously in a conventional office building. Well, what may account for these results? The most prominent elements of Maharishi Vastu are orientation of building and the subject in it, the placement or location of key functions within a house, proportion, measurement, and bilateral symmetry, exposure to the rising sun, and various elements in the site. Some of the primary principles of Maharishi Vastu have lent themselves to research in isolation. Let's look first at them now. The system proposes that there will be differing effects upon individual subject bodies when oriented in different directions, as well as upon the occupants of buildings that are oriented in different directions. A total of 7 studies have looked at these hypotheses. Maharishi Vastu predicts that houses oriented to the east first or north second will have nourishing influences on their occupants, and that those facing south will have the most negative influences. And this is borne out in the literature review's findings, in which in the combined study we discovered that subjects who lived in south-facing homes had poorer scores on the mental health inventory than those living in east, northeast, or north-facing homes, and that south-facing homes were 75% more likely to be burglarized than were homes facing east, north, or west, all as the system would predict. Now, a second principle is because of the differing qualities of the sun's energy over the course of the day, different areas of a house will be more suitable for different specific activities. Now, I found no research done on this subject. A third element is that exposure to the east at around the time of sunrise is healthful. The literature review found five studies that lend evidence for that. Another area is proportion, measurement, and symmetry, and I found no research on that. And next is evidence, is influences of certain elements in the site, and also no research done on that to date. And other elements as well, which in the interest of time I will not mention. Our review through PubMed, etc., found 4 studies that examined associations in between health markers and the direction in which subjects were oriented during sleep or recumbent rest. The ancient texts of Vastu propose that sleeping with head, that is pillow, to the east or to the south is beneficial, and sleeping with head or pillow to the north or west is deleterious. In each of the 4 published studies, sleeping with head to the east or south was associated with superior health markers as compared to subjects who slept with head to the north or west, exactly as predicted by the ancient texts. The associations with sleep orientation included heart rate, systolic and diastolic blood pressure rate, score on the mental health inventory, and serum cholinesterase levels. Maharishi Vastu also proposes that one is engaged in focused activity. It's best to be facing to the east or to the north, less so to the west, and worst to face south. A published study found that the speed at which people performed an identical focused task was fastest when they faced east, then north, then west, and last south, exactly as predicted. The degree of brain coherence in human subjects is strongly correlated with IQ, score on a creativity instrument, grade point average in students, and inversely correlated with neurotic behavior. In the study previously mentioned, brain coherence was also measured, and in the frequencies engaged in focused activity, it was greatest in those subjects facing east, then north, then west, and last south, and each of these findings is precisely consonant with the predictions of Maharishi Vastu. Now, what is known to date about the biomechanisms that are responsible for these phenomena? Well, it turns out that when an artificial magnetic field precisely corresponds to that generated by the Earth's magnetic north pole in azimuth, angle, and strength, many human brains respond to them. And that means that there may be a mechanism within the brain that responds to the directions. The study's authors suggest that magnetite, a naturally magnetic mineral that is present in brain cells, is the sensory agent. Much more research is needed to fully understand the biomechanism, but in the meantime, what can we make of the enormous predictive value upon health of this ancient architectural system? Well, in its own texts, Maharishi Vastu is described as the most ancient and complete system of architecture and planning, according to the solar, lunar, and planetary influences on the Earth, and with reference to the North and South poles and the equator, and that it connects individual life with cosmic life and individual intelligence with cosmic intelligence. We may infer from this description that the system seems to be derived from profound insights into the precise nature of the most powerful influences of the cosmic laws of nature upon life on the surface of the Earth. Well, in conclusion, at this stage in the research, we suspect that the ancient architectural technology of Vastu, as revived and systematized as Maharishi Vastu, is of great value as a medical protocol. We look forward to it being subjected to extensive additional research, but based upon the published findings, Maharishi Vastu should already be applied by physicians in their practice when they encounter quite a wide range of mental and physical conditions, applied by asking their patients in what direction do they work and sleep and what direction their house faces, and then encourage patients to sleep with head that is pillowed to the east or south, to work or study facing east or north, to receive exposure to sunlight at around the time of sunrise, to encourage patients to move out of south or west-facing homes into precisely east or north-facing homes, or at least to create and use entrances on the east or north side of a home if it is aligned to the true cardinal directions. And most ideally, encourage patients to build or move into purpose-built Maharishi Vastu homes. Thank you.